from the campus of the University of Nebraska at Omaha. Consider This, a program of issues and information behind today's news.
There is grim news today about the state of America's health. The average expected lifespan for a person in this country shrank by over 7 months last year, according to the CDC. That comes after an even steeper decline in 2020.
Hi everyone, I'm Kathy Wyatt. Welcome to the 26th season and this week's edition of Consider This. Our topic, life expectancy in the U.S. Joining us to talk more about it is Dr. Ali Khan. Dr. Khan is Dean of the College of Public Health at UNMC. Thank you so much for being here and welcome.
Always a pleasure to talk about health.
All right, how do you define life expectancy?
So life expectancy is the average number of years that a person who has attained any age can be expected to live. Now, there's multiple ways to calculate this. And obviously it's different based on what year you were born in, where you were born, and usually when we calculate this, we also calculate it separately for men and women because women tend to live longer than men.
Okay.
Now again, this is an average. It doesn't mean you are going to live 76.1 years, but there are good calculators, including one on our website where we take somebody's age, sex, race, where they live, their health conditions, such as if they smoke, and we can give you actually a better refined estimate of your specific life expectancy.
Okay, and you mentioned it, but as we sit here right now, doctor, what is the average life expectancy in the United States?
76.1 years, which is the lowest it's been since 1996 in the United States.
All right, and we're going to talk more about that, obviously, as we get into the program, but we're going to put a graphic up for our viewers because I'd like you to talk about how what's happening here is comparing to what's happening in countries all over the world.
So what you can see on the graph is that on average, and this has been going on for the last 40 years or so, that countries comparable to us, so these are wealthy countries worldwide, they have 5 to 7 years of increased life expectancy compared to us. That gap has been increasing over time. And then for the last 2 years there, what you see is obviously the effect of the pandemic. Most countries saw a decline, obviously because of COVID-19, but then had a rapid, of our comparable peer countries had a rapid rebound in their life expectancy. That was not true for the US, which lost 2.7 years, whereas other countries lost about 0.2 years.
Wow. And okay, so to add to that, according to NPR, you take maternal, child, and adolescent mortality rates, and those are all on the rise.
Absolutely.
Talk about that.
So our maternal child rate is absolutely tragic, that these moms are dying when they don't need to die. So it's gone up about 40% between 2020 and 2021. And compared to our peers, so other countries that are as wealthy as we are, it's tenfold higher than in those other countries. And when we talk about life expectancy and compare to other countries, I like to remind people that economically, we have done so much better than our comparable peers in the last decade. We spent so much more on healthcare, and yet they are outpacing us in life expectancy. So that's on maternal child health. Now, about 5 years ago, we saw something unprecedented in the United States that has happened nowhere else in the world, which is life expectancy started to go down 5 years ago, and it's continuing to go down. So we are alone in every other country, life expectancy is going up. For us, it's going down. And originally 5 years ago, the thought was that this was due to what we call diseases of despair. So this was generally middle-aged white men, often rural, often without college education, who were dying disproportionately compared to historical numbers. And this was alcohol-related diseases such as liver disease and heart disease, suicides, drug overdoses. So that's what we started seeing 5 years ago. And tragically, that's bad enough, obviously, right? That now has extended to young kids and adolescents. So between 20 and 21, I think we saw a 10.3% increase in deaths amongst that age group, then another 8.3% between 21 and 22. And so currently, the same thing is happening. We're seeing a decline in life expectancy in young kids and adolescents that is happening in the United States. Again, driven by some of the same factors. So 50% of these increased deaths are gun violence. So gun violence currently is the leading cause of death in America for our children and adolescents, and that includes then about 20% is around poisoning, including overdoses and then road accidents and other elements that sort of gets you that extra deaths that are happening in our communities.
Wow. And then you mentioned it earlier, COVID. So when people ask you, Dr. Khan, how much is COVID really playing into the topic today, which is the life expectancy going down? How much is that really affecting it?
It definitely affects it, but as we've been discussing over the last few minutes, this decline in life expectancy and the gap that we've seen with other countries did not start with the COVID pandemic, right? So it's been going on for a while, and the underlying factors are independent of COVID. So yes, without a doubt, COVID is playing a role, smaller role than in adults, a bigger role in adults, especially adults who are not vaccinated. But you know, other countries have sort of rebounded, and we have not rebounded. And it's just because of that underlying trend for life expectancy to be going down in the United States. I also want to tag this to equity issues. Often when people think about life expectancy and hear me comparing it to other comparable countries, they go, well, yeah, because it's due to inequities in our communities. You know, we know life expectancy is a lot worse for African Americans and blacks in our communities. That's number one, that's unacceptable, right? Babies are born, we know from the Genome Project that, you know, 99.9% of our DNA is the same. So we have, at birth, every child has an equal life potential. But even if you exclude the racial minorities in our countries, affluent whites in our countries do worse than affluent people in other countries. So it's not just a function of, well, yeah, because you're sort of rolling up some of the lower mortality, some of the individuals in our communities, unfortunately, who are subject to greater racism or other inequities that lead to these lower life expectancies.
Yeah, some theories out there. I know economist Paul Krugman actually said that he believes this is political, that life expectancy is actually lower in states governed by Republicans. How do you respond to that?
So the data is unequivocal, right? So this is Paul Krugman, economist, and I think he talks about the red state death trip. And so when you look at the data, if you look at like 30 years of data in life expectancy, and then you compare that to voting patterns during the last presidential election, you notice that life expectancy is lower in states that tended to vote Republican versus states that tended to vote Democrat. And even without looking at that fine data, again, this is a correlation, not causation, that correlation is stronger than it is for income, because many Democratic areas are more affluent than Republican areas. So it's still tied to the politics. And we see this, if you step back, right? Don't look at math, you know, where's the lowest life expectancy in the United States? Alabama, Mississippi, Louisiana, West Virginia, right? So intuitively, we know that this is true, that these are areas where there's greater risk and lower life expectancy. What Paul says is this is really due to policy decisions, right? So for example, did you expand Medicaid, right? That's not due to cost decision, because most of that cost is borne by the federal government. It's a policy decision to not expand Medicaid. Did you promote COVID vaccination to save lives? Yes or no? That's a policy decision that decides whether people live or die. Are you limiting women's reproductive rights and health care? That's a policy decision that determines whether people live or die. So that's what Paul's thesis is, that it's these policy choices that people make, different parties make, that determine the health of their communities.
Okay, and we'll revisit that in just a minute, but I want to take a deeper dive here, and you've done a nice job of kind of opening this conversation up, but we're going to put a graphic up for our viewers that talks about really the why. What are we as Americans doing on a, in some cases, daily, regular basis that would be playing in to all of this? Doctor, could you please walk us through this graphic?
Yeah, so before I walk you through the graphic, let me step you back a little bit to think about life expectancy. So as I said, when you think about the Human Genome Project, men, women, race, ethnicity, it all is a wash, right? We're so genetically close to each other that we should have the same lifespan if we're born, and that's not true. And so I talk about life expectancy the way I talk about thermostats. It's a dial, and you get to choose how much life you want your community to have. And this dial is turned by politicians and communities when they make decisions about what policies they want within their community. And so some of this stuff that you saw in the image about why are we seeing these increased deaths in the United States are how people have turned the dial. Have you decided that you want universal health care for people? Have you addressed broadly the social determinants of health that determine what your life expectancy is going to be? So that's just more than medical care, right? Have we talked about transportation? Have we talked about education? Have we talked about safe, viable neighborhoods, right? Have we talked about food security? Have we talked about economic security for individual housing, right? All of these things come together to decide how long we live, and that is the dial that you turn. So we talked about comparable countries, right? I want to take you away from comparable countries. I want to take you back to the United States. We choose, as Paul Krugman said, how to turn that dial within our individual communities, counties, and states. So if you live, for example, the difference between Mississippi and Hawaii is 10 years of life expectancy. I'm very sure Mississippi babies are just the same as Hawaiian babies. Why is there a 10-year difference in their expected lifespan? Or let me take you to two counties. Let me take you to Summit County in Colorado and take you to Ogallala, Lakota County in South Dakota. There's a 20-year difference in life expectancy between those two counties. And nobody is going to convince me as a pediatrician that little babies in Summit County, Colorado are any different than little babies in Ogallala, Lakota County in South Dakota. These are policy decisions, how you turn that dial to say that you are going to live 20 years less than your buddies who are, I don't know, 700 miles away, whatever the difference is between Summit County, and South Dakota.
Okay, thank you. That is a good visual for us to have as we put this graphic back up, because some of this stuff is stuff that we ourselves can control. Correct, Doctor?
Absolutely.
Yeah.
So these are community level issues that can all be addressed by community action, which is what is public health, right? Public health is a community coming together and saying, this is what we're going to do collectively for everybody's health. So racism, obviously, we know racism takes a great toll within our communities and is responsible for many of these health inequities we know lack of universal health care, policy choice, higher child poverty, policy choice, right? Social isolation, how much cohesion there is in communities, policy choices, consume more calories. I joke with people, I need to be careful because I love corn and soybeans as much as everyone, but are we subsidizing broccoli and Brussels sprouts and spinach, right? If you only have $10 to spend on groceries, you're going to be very careful about what your choices are. And shouldn't the healthy choices be absolutely the cheapest choices you could find?
And accessible.
And it's obviously accessible also,
Yeah.
right?
Yeah.
Right, without food deserts. But these are policy choices, right? So all of these are policy choices that we have decided on how healthy we want our communities to be.
Right now, we probably have viewers that are just shaking their heads and going, "Okay, how do we get back on track?" And we're gonna address that, and I'm gonna ask you about that in a
Okay.
minute. But first, I want to ask: is there anything that Americans are doing right?
Oh my gosh, tons of things Americans are doing right. I see the world, right? I tackle outbreaks worldwide, right? So I've seen a full spectrum of health systems worldwide, and I can't wait to come to the United States, right? I love being here, given the quality of our healthcare. But from a public health standpoint, we do tons of things right. So think about, number one, tobacco control, right? So if this was 40 years ago, I would be smoking here while I was chatting with you, right? Those days are gone, right? We have gone from about 35% of people smoking to now 12% of people smoking. Policy choices, excess taxes on cigarette, smoke-free indoor spaces, smoke-free outdoor spaces. I mean, all sorts of policy choices we made that said, let's drop this rate of cigarette smoking, and that leads to very quickly some of the other gains that we've made. So for example, heart disease, right? Dramatic decrease in heart disease within the United States because we've decreased smoking, we've addressed hypertension, we're addressing high blood pressure, we're addressing cholesterol, right? So we've seen, and I actually went and got the numbers for you because I want people to feel good about the great things that we do. So hypertension, so since the beginning of this century, we've saved from heart disease 3.1 million premature deaths. 3.1 million people. They still died. We all have to die one day, but they didn't die early because of the great work that we're doing within our communities. A COVID vaccine saved 3 million lives, $1 trillion, right? Great example of good public health in communities to save lives. Health coverage, thanks to Obamacare, we added another 20 million people to get universal health coverage, so we're only left with probably about somewhere between 20 and 30 that don't have health care or inadequate health care access. And the last one, again, as a pediatrician, is lead exposure, right? We have put policies in place. I hope I mentioned policy at each one of those to make the point. Am I being too blunt?
No.
Good policy leads to good health,
Yeah.
right? So I believe 1.4 million kids are less likely to have elevated lead levels now. And lead is horrible because it's bad for kids' brains. There you go. I could give you many more, but there's lots of things that America is doing really well.
Okay, so by that, I would imagine it's not too late to try to turn things around, but it's going to be a big job, Doctor. So what would you say that we would need to do, adding to all the good things that you've just stated, what would we need to do to really start to turn this thing around?
I think the lesson is in the good things that I just mentioned, which is how do we come together as a community to say that health is important and then work on that within our communities and to advocate with our political leadership to say this is important to us. We don't want moms and babies dying. We think it's unacceptable that if you're a black baby born, you're twice as likely to die as a white baby born in America, right? We just have to say this is unacceptable. This is a never event in a community where we live in because these are our babies who are dying, right? Same thing for reproductive health rights, right? Universal health coverage. Why does everybody not have health care coverage in some way, shape, or form in an affluent community like ours, right? So we have to work on that. It's our responsibility. This is our community, and we need to work with our political leadership to make this happen. And I don't want to get straight too far from Nebraska because, we talked about Paul Krugman, and, again, this is averages. Nebraska, our life expectancy actually, I think, is 17th or 18th, right? So we're not at the bottom of the pack by any stretch of the imagination, right? And this is an amazing state that has made all sorts of critical decisions to support health. So, for example, with the tobacco settlement money, they decided they were going to create health departments across the state, right? So, and then they have an amazing health team at the state health department with the CEO, the head of public health, the state epidemiologist, the head of Medicaid services, the chief medical officer. This is just like an A team of people who are committed to improving the health of this state with a bit of sense of urgency and creativity of how they do that. So again, I want to be careful about averages, right? Because Nebraska is doing well, but how do we make sure we continue to do better and make this place where people don't want to leave, and where people like me come and say, I want this to be my home, right? And so continue to make it healthy for people to come and say they want to be here. And the data is unequivocal. So I worked in Africa a lot on decreasing malaria, okay, thanks to President Bush's Presidential Malaria Initiative. And we used to say that because you were poor, you got malaria. And the truth is, actually, you were poor because of malaria. And if you treated people's malaria, they were healthy enough to go and work. And then all of a sudden, you saw an economic increase. So it's a flip of thinking about it was just poor people getting malaria. No, they're poor because of the malaria. If you address the malaria, they do better. And we see this. So here in the US, Brookings did a study, probably 2019, looking at 10 years worth of economic data. And they saw, again, with this red-blue divide, that states that tended to vote Democratic, their median income went up in the last 10 years, whereas states that tended to vote Republican, their median income, which started higher than Democratic states, actually went down in the last 10 years, right? So keeping people, again, going back to this, if you keep people healthy, they will be economically more viable.
Okay, so
that was a lot to unpack, wasn't it?
No, I think it was great. And actually, as you're talking, I'm thinking, okay, this man has been all over the world and dean of the College of Public Health at UNMC, right? Lessons to be learned in everything. What else, based on your experiences, could we take from other countries? What lessons could we learn and bring it home here to the U.S. and more specifically to Nebraska?
So we can't, some of it's cultural differences that are never going to change. We are an individualistic society. We promote individual freedoms. That's sort of that American exceptionalism of Americans, whereas many other countries have a collective culture, sort of the me versus the we sense. But our values are no different. Find me an American who says, I don't care about my children, I don't care about my mom. I'd be hard pressed to find one, right? I think we have the exact same values. And I think, how do we sort of speak to those values to say, we can save that baby, we can save that mom, right? We can make sure that we have health care for everybody. Right? So I think if we just go back to the values that are important to all of us as Americans and as Nebraskans, I think in there is the seed for the lesson to say we can do this. We clearly have the resources to do this. We would not have to change. We spend twice as much on healthcare as any other of those countries I showed you with the higher life expectancy. So we don't need a single extra dollar. If we just juggle those dollars differently, we would have better health for everybody.
Simply said, but very difficult to execute.
Absolutely.
Right? So
a lot of special interests that have their pieces that never wanted to change.
Well, and oftentimes folks can just get so caught up in the short term, right? What is the short-term success here versus looking out further? So what you're saying makes a lot of sense, but the million-dollar question is, how do we take what you're saying and bring it to fruition?
And it's about advocacy in individuals. You know, gun violence is the leading cause of death in children. If we cannot motivate Americans and our policy leaders to save our kids, what does that say about us as a culture? I mean, what I read recently was that in any average American kindergarten, one child can expect to be buried by their parents. Right? How did we get there? How are we allowing that to happen? And can't we come together for the sake of our children for some common sense gun safety laws, right? There's a place to, that's one, I can think of multiple places to start, but there's one place to start right there, right? Given what we hear in the news every day. So again, we have the right set of values in this country. We can do this.
I want to ask you in just the few minutes that we have remaining, if we just talk about what we as Nebraskans can do, maybe small changes today, right, that will hopefully have that ripple effect and eventually will be to where you're describing that we can be. What would those small things be?
Okay, let me put them in two buckets. So the one is what you can personally do to determine your own personal health, right? And so I talk about the big healthy 5. And so, there's a million things you can do. I said, focus on these 5. And if you can't even focus on the 5, focus on number 1. Number 1 is, for me, is exercise. 150 minutes of exercise every day. Number 2 is eating. I won't tell you what not to eat, but I'll tell you eat 5 fruits and vegetables a day. Number 3 is sleep. Get a good night's sleep, right? Number 4 is don't poison yourself. So no tobacco, be moderate in all of the other things that you do. And number 5 is a purpose-driven life, a value-driven life with friends and community and kindness. So those are 5 things that we can do to help influence our individual health. And then the second bucket is what can we do to influence our community health? And I think everybody listening to me today has to say, I care about gun safety, I care about moms, I care about kids. Find that group that's working on that. Find your local senator and write those letters and say, I care about reproductive rights for all women in my state. Please make this a welcoming state for women, right? Or please make this a welcoming state for children, right? So there you go.
Okay.
2 things, 2 buckets.
30 seconds, final thoughts.
My final thought is we get to choose the amount of public health we want. We get to choose how much life expectancy we want. So my suggestion is choose life, dial up that thermostat so we have better public health in our communities and longer life in our communities.
Okay. I have to ask you something, though. What is a good night's sleep anymore? The opinion is out there. Very, doctor.
It depends on your age. So,
Okay.
But yes, it should be a full night of sleep. There's no this 2-3 hour thing going on.
Yeah, I think sometimes it depends on who you're talking to. We're talking with Dr. Ali Khan today, who is the Dean of Public Health at UNMC. We're going to put up some more information on this life expectancy topic for folks who are wanting more. You can just go to unmc.edu/public health, or the phone number is right there, 402-559-4950. Dr. Khan, I want to thank you for sharing your time, your expertise, your stories, and for everything that you are doing for our community and beyond to make life a better place for everybody.
Thank you very much. Very committed to making Nebraska the healthiest state in the union because we are the greatest state in the union.
Thank you very much. Thanks to our students who are working so hard behind the scenes.
Yes, thank you to all of our students.
Yeah, and of course to all of you for watching. We will see you next week.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at nebraskapublicmedia.org/considerthis. If you'd like to share your comments about this program, call UNO Television at 402-554-2516 during regular business hours, or send an email to cwyatt@unomaha.edu.